Thank you for joining us. I'm Huntley McNabb, the Vice President of Marketing for Professional Credit. I'll be your moderator today. And it is a lovely Valentine's Day here in Springfield, Oregon, the home of the Operations Center for the Hawes Group. The Hawes Group includes Professional Credit, an AR management company, HealthFirst Financial, a patient financing company, Hero Business Services, which provides first-party collections, and Hawes Technology, which develops software to enable better consumer financial engagement. The topic for today is improved collections and promote positive patient relationships, best practices for hospitals. And before I introduce our speakers, I'll cover some housekeeping items. First off, everyone remains on mute. However, you can ask questions at any time on the dashboard to your right. If you do not see your dashboard, look for the arrow in the top right corner of your screen. You click that, it'll expand the dashboard. Also, because it is Valentine's Day and because we want to spread the love, everyone who attends gets a box of chocolates for us. So you'll be receiving an email after the presentation with the ability to confirm your mailing address so that we can get those to you as soon as possible. Also, if you have any sort of technical difficulties, and we will respond to those immediately through the question bar. Your other questions we'll save for the Q&A portion. Here are our speakers. First, Jeff Johnson, the Chief Marketing Officer of Professional Credit Service and the Hawes Group. Good morning, Jeff.
Good morning.
And also Lisa Smith, the Vice President of Operations for HealthFirst Financial. Hello, Lisa.
Good morning.
So between Lisa and Jeff, they have many, many years of experience in working in healthcare provider organizations, as well as organizations that serve healthcare providers and their patients. They've also spent a large portion of their careers developing staff to improve operations, financial operations, and to improve the patient experience. Today they'll be talking about why it's so important right now and why self-pay collections are such a challenge for both providers and patients. We'll talk about the industry trends that are driving these challenges, as well as demographics that are affecting the way we engage healthcare consumers. We'll also go over patient pay cycle and the best practices within that cycle to improve collections and patient satisfaction. And then at the end, we'll have some questions. So Jeff, why is this important? What's happening in healthcare right now?
Thank you, Huntley. What we continue to see in healthcare today is that ever-increasing responsibility to the patient. And as we're going to talk about here in a little bit, that continues to trend more and more patient responsibility for all their obligations in healthcare. One of the things that's interesting, since 2000 alone, patient responsibility has risen from 4% to more than 30%. Patient responsibility.
Wow.
And how does that impact us as healthcare providers? It just really makes it more challenging to get the payments in that we need and ensure that the patient experience is a great one as well. 64% of Americans report postponing care still due to the high cost of these deductibles, and some of these delays are obviously creating increased diagnosis of chronic conditions, which lead to increased medical debt.
That delay is an interesting point, Jeff. I was reading an article just last week that there's a study that there's 15% of physicians are also delaying their own care due to these higher deductibles.
Oh, it's incredible.
Very shocking. And we do anticipate, as you can see in the following slide, the cost of healthcare will continue to outpace even the wages of individuals, and deductibles alone have skyrocketed up to 67% since 2010. It's interesting, most millennials are actually choosing a high deductible health plan, forcing some of these higher curves that we're seeing in healthcare.
So let's talk about millennials a little bit. What do we know about them? They constitute 1/3 of the current workforce. 65% of them say they could not afford $1,000, yet they're choosing those high deductible plans. 54% have delayed care. Now, part of that is because they don't think anything bad will ever happen to them. but most are likely to seek information online. They're also more likely to dispute their bill, and as you said earlier, they're into those high deductible plans. They also tend to be more questioning of cost and have less loyalty to a specific provider. They're going to make their choice. They're going to do their research, most likely online, and make choices based on the cost information that they can gather.
And if most millennials are like the ones I know, they're probably, when you talk about accessing this information online, it's probably with their phone, right?
Absolutely.
Definitely. Driving things with technology becomes very big for this generation. Another thing also impacting our ability to collect is what's happening with the other generation, who we call our baby boomers. And our baby boomers, whether we like it or not, there's 75 million of them, 28%, and we expect for the next 20 years, 3 million to be added to that number. Now, how do we, as a healthcare provider and a system, supply the need that will be required for this type of population? Definitely a big question that's sitting out there for all of us in healthcare, but also we have to look at more creative ways to deliver that type of care and understand the impact that it's going to have on the
Right.
Well, and I would think that the boomers are also, while they may have some different needs than the millennials, they're also consuming more care, so you have to meet their needs as well.
Right.
They may not be as adept at accessing this information online or using some of the new tools. However, some are. They're adapting, but you definitely have to provide different solutions for them to engage.
Right. With the boomers, you often have where medical care is kind of built into their overall budget because of the chronic nature of their situation, whereas with the millennials, you're generally dealing with either singular or more acute situations.
It's interesting, I read another article that just came out today about Medicaid and the impact on the baby boomers. And interestingly enough, the baby boomers are being required today to even pay more for their Medicare than they had before. So we talk about this self-pay piece. It's impacting everyone. It's not just impacting.
Right, and as people are planning for retirement, in fact, many people are not planning as they should for retirement, but even those that did very well, they did not account for the high cost of health care and the out-of-pocket expenses they didn't anticipate.
So patient pay facts. So what do we know? Patients' pay responsibility, again, up with the deductible, the patient pay responsibility, that self-pay, is up by 30%. So basically $1 out of every $4 comes directly from that patient. 27% of insured have a deductible of $1,000 or more, even though we know people are either choosing or have those high deductible plans. And we know bigger balances equal that tougher time collecting those dollars. 36% of our patients have past due balances of 60 days or more, and 60% of the amount owed by patients is not collected. So that consumer debt, medical debt affects all demographics, age, income, credit score. It's there. It's not one group over another. Your millennials are going to have their medical debt. Your boomers are going to have the medical debt. It's everyone. It's an equal opportunity situation.
Yeah, I read that in a CFPB survey that said that unlike student loans or credit card debt, which are usually tied to income levels or age or what have you, medical debt spans across all demographics.
Yeah,
crazy.
In fact, in the type of debt collected, I think that's our slide there, it does show that. It shows the impact of healthcare across all generations and, of course, all individuals. And we can continue to expect that trend as we move forward, whether we call it Trump Care or the Affordable Care Act. Mm-hmm. We know that in healthcare, the patient is going to be more and more responsible, and that those balances continue to rise. And our ability then to help the patient comes back to our ability to have the right business partners and right solutions in place.
So the payment challenges. So looking at this, the thought of leaving a grocery store or a gas station without paying for your products or your service, but we just don't, we know what happens. But that's what happens with 1/3 of our patients. But also conversely, you know, where else in our life do we go in with no idea of what we're going to be charged, but we agree that we'll be responsible for whatever that cost might be? We just, it's that type of situation.
And what types of retailers that you go to or what have you that let you walk out the door without paying anything?
True.
Exactly. Another payment challenge that a lot of hospitals face in healthcare, we have what is called the deductible, which renews every year. And so we're now faced with those renewals that are happening about the same time for every patient. And we have months where everything coming into the hospital is pretty much self-pay. Mm-hmm. And so that's a huge challenge for all of us, including what you're referring to before. One of the issues that we're seeing is price transparency as well out there. You talk about going and you're getting the service, but you don't even know what you're going to be paying for it. In fact, I recently was at the doctor, was sick, went in. They were requiring all of these things to treat me, and they were good ideas. But at the end of the day, I asked personally, what would the cost be for me to get this done? It took them 3 hours to have someone provide me that information, and I thought that was very shocking. I'm sure many hospitals out there are not like that, but the one that I was at definitely couldn't give an answer right away, and we need to move towards this consumerism in healthcare.
Well, interestingly enough, I have my own story. My husband had to go to a surgeon to discuss surgery on January 2nd. You and I both know January 2nd we had a new deductible. The scheduler, the front desk, no one had a conversation with us about how we were going to fulfill that deductible. And I even asked, and there was just this uncomfortableness about discussing that, and said, that'll be later. And I feel like I'm more savvy about the deductibles and such, and more attuned to that. But imagine the first 3 months of the year, you're not having those discussions, and you know it's very applicable.
Yeah, we talk about best practices in healthcare, and one of the things in healthcare that we've got to reach is definitely more transparency to that pricing piece for those desiring to get those services done. It should be almost a printout that you hand someone, because we have options as consumers today to go elsewhere and get that care.
Right.
Even as sick as I was willing to go to another doctor and receive that care if I couldn't get the answer that I needed.
Great. So, there are all these challenges here. So what do we do? What are the best practices that we should follow in patient pay so we can improve the situation?
So we look at the patient pay cycle overview, and you've got your pre-service, your time of service, initial billing, your aging accounts, and then ultimately collections. And I kind of like to compare that to that whole continuum of care. This is the continuum for financial care. At every point in time in that patient pay cycle, you should be having the conversations. It should never be a surprise, and you should have options all along that continuum or cycle. Pre-service, those new patient forms need to be online. Again, we've got our millennials. They're checking out everything online. You should be able to email, text, or voicemail confirmations and reminders of appointments. But I would suggest on those forms, you'll be talking about the payments, that there needs to be some language on there. Time of service, you should be getting the payment. We should be talking about payment in full. And if not, what are the options? Also, if you have financing, that's the time to talk about it. Initial billing. If you're going to have the discount, make sure they know that if they pay in 30 days or less, that there's a benefit to them for that. And also, you should emphasize the payment options at that point. Now, your aging accounts, those 60 to 90 days since their first billing, need to be firm, but you should also talk about the consequences of inaction, because don't want anybody to be surprised by this, but also have options available even at that point. Because ultimately, voluntary payment is what we all want. And then, of course, for those that either choose or can't pay, there's always the collections piece, and you should really be looking for that compliance-driven collections. It's good business to make sure that they're representing you in the manner that you need to be represented in.
Right, Lisa, and as I look at all of these, this cycle, I think one of the biggest pieces that helps is technology. I mean, we talked earlier about the millennials, the fact that they love to be communicated with a mobile device, or they're using their mobile device. Not just the millennials, but now we're seeing that with so many individuals today. So not taking advantage of technology that could help in each one of these categories definitely hinders the experience for the patient and also our ability to collect that money, which is coming more and more from the system.
Right. Particularly, you're looking at a population, basically 83% of people in the United States have a cell phone. And 67% of those that have cell phones have smartphones. And they might not have a computer at home, but they've got one in their hand. And so when we talk about that best practices, an updated website is critical. People need to be able to find the information they need. And a patient portal. Where can they go in and basically self-service through the portal? And if there's a mobile app, even better, because people want to be able to make their payments or access their account when they want to. If it's 3 in the morning, great. If it's while they're waiting for coffee at Starbucks, that's great too. Make sure that you are offering that information about patient financing. Oftentimes, we aren't talking about that, but it's only when the patient says, well, what are your options? It's really good to always ask for the payment in full, and when you get the response, I'm not able to do that, then talk about what the options are and make that available. Verifying the insurance at the time the appointment is made so that there's no lag in getting the processing done, because what we know is the sooner that you're able to bill, the sooner that you're able to make that request for payment, that they equate that with the service in their mind, the better your results are going to be. Always direct the patients to new patient forms online. They're more likely to fill them out. They're more likely to fill them out completely and correctly when they can do them, complete them in the comfort of their own home where they have their information. And make sure that you conduct any prior authorizations in a timely manner.
Great. Which really moves us into the time of service as well, right, Lisa?
Correct.
And some of the steps that we need to take there, obviously collecting the co-payment, offering financing based on those estimated balances is something that should have been done in the pre-service, but where that can't be controlled in pre-service at the time of service, definitely something that should be offered. And making it clear throughout your facility what those options are.
Absolutely.
I would go and extend this one step further and say, based on my recent experiences as well, bringing in the entire team, and that includes the doctors, and I know that sometimes that's a challenge. Many times I hear the doctors say, I don't know what our costs are or what our options are because I'm here to provide your health care. But part of my health care is also the fact that I'm going to have to pay for it at the end of the day.
Right.
So if the doctor doesn't have some education on that or the ability to pull someone in who has that information, I'm very turned off as a consumer of health care. And of course, I'm questioning this facility that I'm working with as well, whether or not they're going to provide the best care for me, because it's all inclusive, right? It's just not what my doctor's telling me, but it's the entire experience.
Right. And having that defined financial policy available. This is an important one here, the training staff on how to discuss financial responsibilities from your front desk, your schedulers, to your billing office. Making them comfortable with having discussions about money. Having your front desk staff as comfortable with asking for the payment in full as the schedulers, as the billing office. It's everybody's responsibility. And it's not counter to providing a superior patient experience. having somebody come in and know what their options are is actually going to be much more of a pleasant experience than to have that cloud of, I don't know what this is going to cost, I don't know how I'm going to pay for it, and that's how they're going through the whole intervention, medical intervention. It's much better that they know, oh gosh, I have financing available, or gosh, with the discount, I can handle this. It's much better to have it all defined. It makes for a better patient experience.
It really does. And one of the things that I've noticed in a lot of the healthcare systems is that the reason this discussion isn't necessarily happening, one, we do have to train the representatives to have the discussion, but a lot of it is based on environment. The environment where our reps are placed doesn't give them the opportunity to have that private conversation. I was with my wife recently for a surgery, and there were 3 doors headed into the place where we were having this discussion. All 3 doors opened at various times during this discussion, interrupting the individual, never giving her an opportunity to really have a one-on-one discussion with us about what our responsibilities would be moving forward. So as we look at these best practices, it's not just talking about it, but it's also taking a look at where we're placing the patient and our representatives so that they can have that healthy discussion and, of course, cover this important information.
Well, and understanding for staff that asking for payment is difficult. But generally, it's difficult because of all of the roadblocks we have in our mind, as opposed to the patient expects that there's going to be a bill. They might not know what it is, they might not know how they're going to pay for it, and that's our job, is to deliver that information.
So true. Talking about those payments and patient options, I think that's really big. In healthcare today, having options available to the patient becomes key in being able to collect that money. So again, we talked about that copay or deductible, and it's important that we ask for that upfront and in full. Why delay, right? We know it's going to be something that we have to do, but how do we get it all?
Right.
Offering some installments, either by the hospital or by the clinics, whoever they're going to go see. And then really what's trending today, and the most powerful tool that we're seeing out there, are these financing programs being offered by third parties to the patients as they come in and have this large out-of-balance portion that they have to pay.
Absolutely. And having those options available, studies are finding that it truly creates greater patient loyalty, and also better word of mouth. So if you're going to recommend to your friends and family, there's really no higher compliment than that. But to be able to say, I was really scared how I was going to take care of this, but because there's longer term, low-cost options, I was able to do this. And when you think about it, 60% of healthcare organizations say collection from the high deductible plan are one of their top 5 challenges. Having the conversations early, having the conversations outlining the options, not waiting for it to get to a critical point, and having that continuum. Like I said, we have a continuum of care. We should have a continuum of healthcare financing care.
Right. It's a shame that this bullet about delaying care. It's a shame that people have to delay care because there's no financing in many cases. Whereas you never have to delay buying a pair of jeans or going and buying a big screen TV for the Super Bowl or something, right? But we can't go get essential care when we need it.
Excellent.
And I think these are great stats in terms of how many patients would take advantage of financing if it were available.
So what we know from a variety of different studies out there is that patient financing does increase patient loyalty. If I know that I have a procedure and coming up and I know that I have financing options, I'm most likely going to go to hospital A that has the option as opposed to hospital B that doesn't. So, and being able to add additional charges from that hospital, all of that goes into increased patient loyalty. One thing I would also encourage is that when we're looking at the bills that the patient receives, make sure that that's understandable and all of the insurance data is collected, that we're talking in terms that patients can understand. I know if you use the term EOB, we know what that means, but so many insurance companies aren't even sending EOBs. So that explanation of benefits, when we're shooting those acronyms to folks, they don't know what it is. Oftentimes they're embarrassed to ask or feel like they should know. So let's make sure that we have bills that are understandable, that we're sending them as soon in the cycle as possible, so folks aren't in that anxiety stage or hoping that you just forgot. So don't wait for the monthly cycle. We talked about the discounts. That's encouraging. And include a phone number that's easy to find so that folks can call in with their questions.
I think as we look at these patient financing programs or just any program that offers some payment option to the payment, it's about communication as well. And I know that a lot of the healthcare facilities that we've worked with, they believe that they're communicating it clearly because they placed it on a website, but it's not internally documented anywhere when a patient walks in, or maybe it's not being communicated by the representative as well. So it's the consistency of that communication across the board that really helps drive these programs to be successful and, of course, make that experience for the patient a great one.
Absolutely. So the best practices, I went over a little bit about this with the billing. One thing that's really critical is include an insert about your options, your payment options, in the bill. That way it's right there. They're more likely to call you if they see in an insert that there are options for them. I know from my experience with HealthFirst that people are saying, I was so scared that I didn't know how I was going to pay this. I dodged phone calls. I didn't even open any of the bills after the first one. If you include that insert in the very first one and they see that there's options, it's going to make collection a lot more.
Yeah, I do believe that a lot of the companies like HealthFirst partner to make it very affordable to get those types of inserts into that initial bill.
Absolutely.
I know it's also very important to send that first bill as soon as possible, and we can't stress that enough. We know that the earlier the engagement is with the patient, the better it is to be able to collect those. And of course, as you mentioned before, providing all that discount information and phone numbers for questions.
Right.
Always great.
Well, and that the phone number is easy to find. Because we know there's a lot of regulatory language on billing, sometimes the phone number is really tough to find. And we want to make sure that the folks have no reason not to call in.
I know. As I look at various websites for healthcare systems throughout the United States, I'm always surprised that there's a contact us button, but there's no phone number on the main page when you log in. So what a great practice.
Okay. So let's talk briefly about aging accounts. We still should be sending our reminder bills. And the more options we have for these aging accounts, you know, your reputation in the community is so important. The more empathetic your hospital is going to appear because you have options. And patients with outstanding balance, you can establish a payment plan before scheduling a new appointment. The payment collection and the positive patient experience do not have to be mutually exclusive.
Because it really is about the patient experience, the patient relationship at the end of the day. You're talking about that quality of care and that empathy, and the collection of payment needs to go across the entire continuum, as you've said, of care. And we agree with that 100%. In fact, patients' number one complaint is that they're not being provided, enough information up front, and they want to be part of their healthcare experience. They don't just want to be told what to do.
Absolutely.
And that's where we run a little bit more into some of these best practices that we want to talk about today. We want to move on and talk a little bit about best practices in collections and what that looks like. I think in the past, we're used to collections being that really negative experience where people, maybe Guido's coming to bash the payment out of someone. But today, that's different. We want the experience to be great. People are recovering. They need to know that the individual that they're going to work with, if for some reason it went past due and it's in a collection standpoint, is going to have the same type of compassion that the doctor would have. So in choosing this, you want to make sure that you're looking at those vendors out there that are in alignment with your own mission, vision, and values. We know that. But what we're seeing as a trend and best practice in collections today is really using decision science and behavioral science to find those patients that have the ability to pay and can pay now, work with them while having different options for those who do not currently have the ability to pay. So again, it's that focus on who can pay and will pay versus pounding it out of everybody at the end of the day. Also, best practices, one reminder to everyone is that your agencies are your responsibility. So what they do falls into the same guidelines that you have. So if you have chosen a vendor that's not in compliance, their non-compliance becomes your responsibility today. Because of the new federal laws, they do guide that. So you're going to be wanting to look for an agency that is an FDCPA compliant, that's not doing the legal threats, but is driving those business plans or those payment plans for you. Even a program that might be willing to go back and offer some of those payment plans that would be through these financing organizations. You should definitely have access to call recording. The best agencies out there are providing not just the calls, but they are also giving access so that you can pull those calls directly. That's a key element. Where, another best practice in the key and the top agencies is that we are seeing auditing happening on speech analytics and auditing happening on every call, not just a sampling of those calls. So you're going to want to make sure that you're choosing a partner that is doing that. And a partner that's analyzing and looking at that propensity to pay, just like you are looking at that propensity to pay internally. And of course, one of the things that is key in healthcare today is the ability to remove that from the credit report once the patient has paid, not dinging them the rest of their life because they had a moment where they weren't able to pay that patient obligation. So talking a little bit more about this call recording and analytics, which have become so key with technology today, some of the best practices out there, as I mentioned before, are doing that. Here's a dashboard of a really cool product that we're familiar with called VoiceTrail that gives instant results as to what's happening with the calls and also what's happening on those calls. It's actually showing real time what's occurring and bringing to supervisors' attention just the trend of that call, whether it's an elevated voice and it's going up or it's going down, or maybe keywords that are being said or not being said are being analyzed along the way.
So Jeff, in your experience, are folks using this in conjunction with behavior science?
They are. Definitely using it in conjunction with behavioral science, seeing what trends are on those calls and finding out better ways to approach that specific population.
Oh, that whole psychology of payment.
Yes.
Great.
And agencies that are the top agencies are using those behavioralists, working with their collectors, trying to find also key moments when a certain population would pay versus not pay. And of course, monitoring those calls, listening to that is a key element too.
So I should expect that my agency will be providing me information like this?
Definitely.
On a monthly basis, or?
It should be real time, where they can actually go in and look at that information and see the success of each representative with that agency. And that's key. And that is what we're seeing as the best practice and trend. We will see that on the speech analytics, call recording, and of course, just complete access to your data, because at the end of the day, you are still working with that patient. They are still your patient, right? And you hope that one day they'll continue to come back and receive care from you. So with that, I think moving into the recap, it's so important to know your patient demographic. I'll say it's also important to share that patient demographic with your vendors. Many times you're so familiar with them that you have a tendency just to assume that your vendor is that familiar as well. That's not always the case. So whether it be a financing vendor up front, or whether that be your professional collection agency that you work with, you want to make sure that you're really sharing those patient demographics. What are the trends that you see with your own population? And then know the challenges that your patient population is facing, and share that as well. Provide solutions for those challenges, such as making sure, as you talked about, Lisa, those clear bills up front, payment options through, whether that be third-party or internal payment options. Big thing that we talked about before, transparency. On the website, in your documentation, in your discussions with the patient, being completely transparent.
I would also add that accessibility, having the web presence or the mobile app, all of that, so people can self-service, do what they need to do on their time, as opposed to necessarily on your time if you're an 8 to 5 operation.
I love that. And of course, maintaining compliance in collections is key. As I mentioned before, whatever your agency does will come back on you. So it's key to ensure that you've partnered with that agency that is completely compliant, that has the certifications that they should have, and that they're keeping those certifications fresh and relevant. And part of that is them being completely transparent for you. Do you have access to all the data? Can you see the actions that are occurring? Can you pull a call whenever you need to pull a call? Can you ensure that that experience for the patient is continuing, as you mentioned?
And I would say that's as important with third-party financing also. You should be able to pull calls. You should expect compliance and transparency.
That's right. Technology driving that.
Well, great, guys. Thank you so much. I think we've gone a little bit over time here, but we can stick around for some questions. So if any of the attendees have questions, go ahead and click on the question bar on your dashboard, type it in, and we'll respond. We actually had one just a little bit ago. I think, Jeff, you had talked about certifications. What sort of certifications do we look for? It says just that they're FDCPA compliant, or is there a specific certification that we should be looking for?
Well, ACA, which is the governing body for collections on the back end, has produced a wonderful program. It's called PPMS. And the PPMS program, it's very challenging to become certified in that, but you can know that if your agency is PPMS certified, they definitely are in compliance with all the laws and regulations that are being required, giving you a little peace of mind out there. So I'd definitely be looking for that particular one. Some other certifications that are out there are ISO certifications, just data security in general, because we're dealing with patient information. We want to make sure that it stays secure.
What about what about just the peer-reviewed sorts of products? I know HFMA has a peer review program. I don't know if that's what's entailed in that particular program, or.
Well, that's a tough program, as you know. To be peer-reviewed through HFMA is a challenge because you have to provide to HFMA not only your client base, but people who chose not to work with you. And they have to give you the highest rating in order to get that peer review. So that is another grade.
But if you're looking at the peer review, HFMA peer review, also know what they're reviewing. Are they reviewing a piece of your component of your program or the entire program?
That is correct. Makes a big difference.
It does.
I appreciate that.
Okay, so we have another question here. It says, let's see, when should we offer a prompt pay discount, and how much is typically offered?
So I would say best practice is, of course, to gather the full payment up front and from the patient, and then, of course, if that is not a possibility, knowing and having clearly documented what that prompt pay balance for payment is, what that discount is to the patient, and then taking steps to collect that up front, or at least put them on a payment plan to get that in the time that is required in order to obtain that prompt pay discount.
Oh, here's an interesting one. I guess this term is now replaced Obamacare. What, if anything, should we do to prepare for Trump care with regard to self-pay collections?
Well, that's a great question, and trending, right? We don't know where that's going to end up, but we do hear more and more, and it looks like things are going to definitely be pushed more to the self-pay hey, patient responsibility in this. We expect HSAs to become a bigger part of that. With that, and I'm glad you bring that up, it's about us being aware of what's going on. And with these trends, I would say stay actively involved in your HFMA chapter. Make sure that you can educate the chapter, the patient as well, and make sure your staff is educated on those changes early on so that the patient's aware.
Great. And Jeff, I think you need to speak a little bit louder.
I will speak louder.
Sorry, that was not a question. It was just a comment. Okay, so what about training? At least you talked about making sure people know how to ask for money. Are there training resources you could recommend that would help people guide their staff in asking for money?
Absolutely. There are trainings available through HFMA and MGMA. I'm looking at you because Jeff, because you're more involved with MGMA. But also, there are a number of tools that are available through our Speakers Bureau also regarding the patient experience, how to evaluate how you're responding to patient needs from that billing office, and how we can do a risk assessment on that and help you develop a really robust patient experience.
I think that is key. I think, Lisa, as you mentioned, just going out and working, whether it be through the Hawes group or through another entity, just getting that assessment, really building that plan, and making sure that you've accessed all those training resources become key for your organization.
There are so many things out there that you can do to enhance the patient experience from the billing office standpoint that doesn't require a financial investment. It's just looking at it from how your patient views it.
Agreed. Great. I think that's all the time we have, guys. So for the attendees out there, we will be sending out an email so that you can confirm your mailing address, and we will be sending you chocolates. Thank you so much. Also, we'll send you a recording of the webinar so you can review that, have the slides, and be able to share that with other folks. Thank you so much for attending, and have a great rest of your Valentine's Day.